Hi, everybody. I'm sorry for the delay of getting started today. We had some technical issues, and I'm not very good at it, but Megan certainly is, and I think she's got it all sorted out. I'm the problem, actually. So, today we're going to talk about testosterone in women or androgen insufficiency. So, testosterone is a hormone that is commonly thought of in men, but women make it as well. And the importance of this talk is that so often we neglect to think about some of the physiologic and um, physiologic and basic effects, both for psychology, for physiology, for how our cells function in our body when we consider testosterone, especially for women. For men, we understand that it's the major hormone that's important for most of the things that we function in. It's important for our mass, it's important for our libido, it's important for our wellness. But we often forget how important it can be also for women. Now, one of the things that we find that testosterone is important is for bone health. We know that if we have low testosterone, we often have osteoporosis and osteopenia. And that's one of the things that probably for most of the people that come into my office into Bozeman Sport and Spine is we look at people that have osteopenia. They might have had a compression fracture. They might have had a fracture for a relatively minor incident and have developed a fracture, and we're concerned about building up their bone. And we know that we can use phosphonates, biphosphonates, which are those things like um, Fosmax, et cetera, that we're utilizing to help build up bone. But how the body has always done it over all of its years of evolution is used our hormones as a function to help build bone. Testosterone is one of the primary players in that we utilize testosterone to build our bone. So if we have a deficiency of it, we're also going to have some difficulty in building our bone. In addition, however, we understand some of the other benefits. When we look at the literature and we look over time of how people function with and without testosterone. Now, I'm going to direct the talk specifically to women on this talk. And we can, some of the things correlate with men as well, certainly because it's an androgen hormone. It's what we all have in our bodies. But when we're looking at specifically for women, we often forget to think about what testosterone has the capabilities of. Now, you have to understand this, that one of the indications, I guess, that the FDA has made an indication. So there's an indication to utilize testosterone for women, and that's HSDD. That's hypoactive sexual desire dysfunction disorder, rather. So hypoactive sexual desire disorder. So other than that, most of the uses of testosterone are somewhat off-label. One of the factors that is associated with that, or why they're off-label, is that we don't have a lot of studies necessarily in women that um, that they've done over a long period of time and of keeping the data. A lot of the information that we have is case reports, studies that have been a long time ago, back in the 50s and 60s, in terms of looking at testosterone. So as far as testosterone goes, for women, if you have a low libido issue or if you have a hypoactive sexual disorder, then it'll be covered in your insurance. Otherwise, it's probably going to be something called off-label. Now, that does not mean that it's not effective. Many of the drugs and things we use throughout our medical experience are going to be off-label drugs. That means that a drug has been found to be very beneficial for a specific um, factor that is capable of inducing into your body, or a certain resolution of symptoms, or you're feeling in a certain way, it helps. And so we use the various medications in an off-label fashion, and that's similar to what we're using testosterone for as well. But I'm going to read over a list of different attitudes or different capabilities that you might consider yourself, whether or not this applies to you and having one of these disorders. One is loss of energy and or fatigue. Another one, mental clarity or loss of focus, loss of muscle mass, weight gain, decrease exercise tolerance, increased recovery time from exercise, anxiety, depression, irritability, moodiness, insomnia, decreased general well-being, and then decreased libido or sexual desire. So those are some of the factors that have been attributed to have seen significant benefit from the use of testosterone for women to address those symptoms. Now, remember that testosterone is an androgen hormone. It's a hormone produced in your body. It comes from cholesterol. It is transformed into estrogen, and in our body, it is required for women, just like in men, to preserve function. Not only does it help with these aspects that we just talked about, but it seems to help really tissue, which is the lining of all our blood vessels. It helps with to prevent clotting that develops. It helps with our neuronal growth in our brain. So if we look at some of the studies and some of the reports that some people have presented in the past, there's a gentleman named Dale Bredesen, and you may have heard me talk about him before. Dale Bredesen's a neurologist, and he's a researcher out of the Bucks Institute in California. And as a researcher, his study has always been in terms of neurologic disorders. And the disorder that he has spent a significant amount of his time looking at has been Alzheimer's. And so one of the things he has looked at are what are the different factors contributing to how we develop Alzheimer's. And one of the factors that has been in the literature and expressed quite a bit is that when people lose their hormonal function, we have a higher incidence toward developing Alzheimer's disease. So for a man, we always think about testosterone. For women, we think about estrogen. But we also find that testosterone has an effect on the neural growth. I have to maintain our nerve cells in our brain, and it's important to do that. And testosterone has a very specific function in doing that as well as the testosterone does. I mean, the estrogen does. So that's one example about how we end up having a larger problem if we don't have our hormones available to us. Now, one of the incidents that is shown is that when we have about age 20, we start dropping it. By age 30, we have this percentage decline. By the time we're in our menopause, we're probably 70% less testosterone than what we started out when we were 18 or 16 years of age. We find that when someone has a hysterectomy, or they've removed their ovaries, rather, I guess, because the testosterone is made in your ovaries for a woman. It's also made in your adrenal glands, and then it's converted also peripherally in all of your cell structures. But we find that the testosterone level is often dropped by 70% when someone has a oophorectomy or hysterectomy and remove their ovaries. So at that time, we could go through a significant amount of changes. We often find that when someone goes through menopause, pre or post-menopause, right around that area, once we lose the basic support of the estrogen, it becomes even more apparent the loss of the testosterone. So again, some of the different factors that can be presented with androgen insufficiency or testosterone, in addition to the loss of energy and the loss of well-being, is that we can also develop that decreased exercise tolerance and increased recovery time from exercise. So in this community, we have extreme high desire to do a lot of exercise and a lot of activities. And we find that when someone is exercising very rigorously, especially with what we call the HIIT training, high intensity training, that they actually drop their testosterone for a period of time after they exercise. That's one of the factors we are looking in terms of the sports performance of people in relationship to how hard they exercise, what their recovery time is when they're able to return back to their sporting activities. So for people that are not into such a high level of activity, we know that if we're already worn down, we're out of the energy, we're already on that cusp, and we may not have that testosterone available, then we don't recover. Our recovery rate is even slower than what it would typically be when we have a deficiency in our testosterone. So, to go over some of the aspects of hormones and how the hormone replacement is effective for us, there's different ways of replacing the hormones. One way is to place a cream onto your skin and let that get absorbed into your body. Another way is to do a injection, which gets to be somewhat problematic because we have a very high level of testosterone and then it drops down to a low level and a high level and a low level. And we find that that's not as good. And the other way we can do it is inserting a small pellet. The nice thing about inserting a small pellet under the skin into the subcutaneous tissue is that as we insert that pellet, it dissolves in a slow fashion. As we do more activity, it takes the blood flow increases through the area and we actually elevate the level of testosterone that we have in our body. As we decrease our activity, we decrease that. And so by utilizing the principles of we use some lab tests and some other factors to determine what someone's hormone levels would be appropriate for them. As we put the pellets in, we know how they're going to be released, and it gives us that opportunity of putting pellets into just under the skin into the subcutaneous fat. And that can last maybe 3 months up to 4 months without having to worry about that hormone anymore. So those are some of the issues that I just wanted to bring out. The second issue is that often comes up with any of the hormone replacement, especially for women, is a concern about breast cancer. And it's important to know that the only, in a sense, hormone, and it's not a bioidentical hormone, it's a synthetic hormone. It's called progestin. That is the only hormone that has been definitively identified as being responsible for breast cancer. So estrogen always has the bad name in that it does proliferate the breast tissue. But when we combine that, or in our natural history, we have progesterone, and that progesterone counteracts some of the proliferation phase of the estrogen. What they found a long time ago, quite a few years ago, was that testosterone also has an effect on breast cancer. In fact, that was one of the agents they utilized to treat breast cancer. There's a physician, she's a breast surgeon out of the Midwest called Rebecca Glazer. And she has utilized testosterone as a treatment for breast cancer. In fact, so a lot of the same effects that we just talked about just recently in terms of the beneficial effects of using an estrogen, including that well-being, sleeping, improving your mood, treats depression, increases your cognitive function, makes you improve your clarity, your mental clarity, and your function. A lot of times when someone has gone through breast cancer treatment, they're not able, because of a BRCA gene or other factors, they're not able to take estrogen. And we find that the testosterone replacement significantly helps with those symptoms. And as I said, Rebecca Glazer earlier on, she would actually use some testosterone pellets and put around the breast cancer, which would help it shrink to make it a more manageable size when she would go in and do a surgical intervention. So those are some of the factors that go along with breast cancer, with hormone replacement, and how they can impact our lives, including breast cancer. So what I'm going to ask is if there's any questions that anyone has, please post them in our chat area so that we can answer any of those for us. Okay, thanks. So here's a question, it's a great question. And that question is, what are bioidentical hormones? Well, a bioidentical hormone is a hormone that is exactly chemically identical to what your body naturally makes. Now, it is synthesized from maybe a soy base or usually a soy or a sweet potato base, a yam, I think is what it is. And they take a structure out of those plants, and then they manipulate it, but it comes out to being identical to what your body naturally makes. And so when we use bioidentical hormones, it's exactly what your body makes. Now, the difference between bioidentical and non-bioidentical, I think, comes down to a couple different issues. When we manipulate a drug, one of the factors that we that drug, we want some other effects out of it. So, for instance, for birth control, Provera, which is a progestin, lasts a very long time, and it is such a strong, potent agent that it prevents you from having the capability of getting pregnant. If you're on bioidentical hormones, that does not occur. You can still get pregnant. So if you're going to prevent pregnancy, you would have to look at another means, and Provera has been a very strong choice of a lot of people to use for their preventative of getting pregnant. So the Provera is a non-bioidentical. It binds, and I believe that that's the reason that we have such a problem with it, why it contributes to breast cancer, why it contributes to cardiovascular disease, because it is not metabolized like the other natural chemicals in your body. So the bioidentical hormones are going to be exactly what your body has. A second question is, when you do hormone therapy, do you try to increase every hormone or just some of the hormones? Well, when we're identifying replacing your hormones, what we want to do is do a hormone test. We want to evaluate and do some blood levels as to what your hormone levels are. In addition, we want to talk about the various symptoms that you have. We find that some of the that hormones work in a concert, so they work together. If we have some mix match in our hormones, and going off the topic of a testosterone, if we have a mix in our insulin, it's going to affect our thyroid hormone, and it's also going to affect our adrenal hormones. If we have a mix match in our estrogen, that may have an effect on our testosterone. It may have an effect on our um, progesterone, and it may have an effect on our DHEA. All of the different hormones have some different effect on the actions in our body. One of the things that we found is that, for instance, DHEAS, which is a hormone that is utilized quite often, it was always thought to be a precursor hormone, but it has very specific effects. It has an effect on the part of the brain called the hippocampus. And the hippocampus is very important for memory, and it's also important for depression. And we find that if people have very low levels of DHEA, but they have a lot of stress, it seems that there's more injury, more shrinkage of the hippocampus. We also found that testosterone is an androgen, that same area of the brain, the hippocampus and the amygdala, which are quite important for depression, have a very high receptor um, field for testosterone. So if we're low in testosterone, we may develop more depression. And that's one of the theories why testosterone is so effective in treating mood disorders or depression along those lines. So, another question, what time do we have? Okay, here's a question. Would you use pellets or cream? And can you utilize them for the rest of your life? And if you're using them, would that, I think the issue here, or the question is, when you start a hormone. So the very first thing that we want to look at is we want to see what we can do in terms of optimizing your own ability to produce its own hormones. Now they do come from your testosterone does come from your ovaries. So if you're going to be losing testosterone function as well. So the question comes, is it right to replace someone's hormones? Because it's natural that they're going to lose their hormones as they get older. Well, that's an interesting question. You know, for women, it's a bit more difficult. For men, what we see is that the people that they've done this study on some people that are very vital and very energetic and are living well into their 80s, and they're just living a life just wonderfully. We find that they have a very strong sexual desire as well. We find that if you don't have testosterone, you're not able to develop an erection, you're not able to perform sexually. So we find that those individuals usually have a fairly high level of testosterone just naturally, and that they are living a much healthier, vital, well-rounded life, or that life of well-being. We can look at that same sense with us, that when we lose our testosterone or we lose our hormones, and it's interesting now that we're finding more and more men losing their testosterone much earlier. We find younger and younger, um, con- you know, groups of young men that don't make enough sperm because you need testosterone to make the sperm. So as we find that we're losing our hormones earlier than what we used to be, um, developing them. So if we're losing our hormones, if we're losing our, testosterone, and we're losing that capability, I guess the question is, well, that's okay. I mean, you're just getting older. But then why do we use other medicines in our body? Why do we use a hypertensive? Why do we use another medicine for our heart? Why are we using a medicine for our kidneys? Why are we using a medicine for our stomach? And it's not natural. Our body never had those medications. They're all man-made. The difference is that we are utilizing a hormone which is not foreign to your body. We know what functions it does, and we're just replacing that hormone so that we can improve your quality and enhance your quality, your vigor, your mentality, your vitality, your sexual function, your mobility. So those are the aspects, and I think that's a personal decision that every physician would have to make, and it's a personal decision that everyone exploring the concepts of using hormone replacement therapy would want to look at. Certainly, we want to always go over what are the relative risks of any procedure with utilizing testosterone, to look at the studies and show you how and what those risks are, similar to what you see on the TV station all the time when someone says, we're going to give you this drug, and these are all the potential side effects. Everything has a potential side effect. It's just that we're using something that is more natural to the body. So hopefully that this was somewhat beneficial to you. Please write if you have any questions or concerns or thoughts. Would like to have a little more information on. But certainly, if you fall into the category of those conditions with depression, moodiness, insomnia, being tired, lack of well-being, uh, just don't feel right, um, let us know. Come in and talk to us, and we can sort that out, whether or not that issue may have something to do with your hormones. And if so, what are the different options for you? I appreciate you taking the time. Thanks. And you have a great day.